Prosperity for all in a new Jamaica. That's the goal. That's the mission, and with all our efforts, we shall make Jamaica the place of choice to live, work, raise families, do business, and of course, retire in paradise. On today's Jamaica Magazine, we'll get you up to speed on the progress made in the quest for prosperity. We'll also remind you of the importance of preparing for an earthquake, plus screening to reduce your risk of cervical cancer. More awaits you after this public service announcement. Stay with us.
Mosquitoes can spread diseases such as dengue fever. Common symptoms of dengue include fever, severe headache, pain behind the eyes, muscle pain, joint pain, skin rash, nausea, and vomiting. If you feel you have dengue fever, visit your doctor or health center, rest, drink lots of fluids, use only paracetamol for pain. Do not take aspirin or other painkillers. Protect yourself from dengue and other mosquito-borne diseases. A message from the Ministry of Health.
Good day, I'm Stephen McHugh, and this is your JIS News for Monday, January 13. A new National Earthquake Readiness Committee will soon be established by the government to better prepare Jamaicans for the natural disaster. Local Government and Community Development Minister Desmond McKenzie made this announcement during a recent town hall meeting in Port Antonio, Portland. He says the National Earthquake Readiness Committee is to be linked to the National Disaster Council and work along with the National Building Advisory Council. It's part of measures to increase engagement with stakeholders on this issue of disaster. The committee will be headed by Roger Smith from the National Works Agency. Other members will be pulled from the National Environment and Planning Agency, NEPA, the Jamaica Fire Brigade, and the Jamaica Master Builders Association. In addition, Minister McKenzie says a number of well-known Jamaicans have already indicated their willingness to serve on the National Earthquake Readiness Committee. They will examine and make specific recommendations to the government on how to ensure that buildings are constructed in accordance with the various building acts. The local government minister says this is important as more buildings are being constructed, some in areas that are threatened by natural disasters. A new agricultural transformation project is set to start in St. Catherine in just a few months as government takes steps to create more wealth among local farmers.
In fact, in the Bernard Lodge and in the Innswood areas of St. Catherine, we are going to be seeing over the next 6 to 12 months, a transformation starting with 6,000 acres of land, in which we have a dynamic partnership of large and small farmers.
Minister of Industry, Commerce, Agriculture and Fisheries, Audley Shaw, made this announcement recently as he addressed the USAID Farmer to Farmer 2020 conference held at the Ligonier Club in New Kingston. He says the agricultural transformation project will enable production diversification using irrigation technology from Israel, which has a rich agriculture sector that is supported by extracting salt from seawater to irrigate their lands.
In the 60s, we were at the same level of per capita income. In the 60s. They are now at $40,000 US. We're at $6,000 US. And we have the potential for agricultural productivity that is far superior to Israel. So we have to inspire ourselves that why should we be importing mango puree and soursop puree to process mango juice and soursop juice and sell it to Jamaicans and to our tourists.
The project will involve the mother farm concept, where the smaller farmers will get technology support, upfront capital injection, proper fertilization, and guaranteed markets. The Tourism Ministry is pushing to rebrand its annual coffee festival into a product more than just an event. The aim is to drive marketing arrangements to increase local and international visitors to the festival and create an avenue for more international buyers of the local product. The third annual Jamaica Blue Mountain Coffee Festival is slated for March 19 to 21, with the final day being staged at Newcastle in St. Andrew.
After 3 years, we've been able to learn a lot. We've been able to hone our skills in putting this arrangement together, to package it, And now we are at a position where we can create the Coffee Festival product, which can now be again inserted in the market, be tied into packages that we'll be selling to visitors.
Minister Bartlett was speaking at the festival launch last Thursday. The event is being hosted under the ministry's Gastronomy Tourism Network and is Jamaica's flagship coffee festival. More than 4,000 patrons were at the 2019 event. The Custos of Manchester has teamed up with the police division in the parish to launch a crime and violence reduction group. The group includes Superintendent of Police for Manchester, Gary Francis, and Deputy Superintendent Elsa Smith of the Manchester Community Safety and Security Branch, as well as representatives from the Northern Caribbean University, Church Teachers College, and other educational, faith, and community-based organizations. Professionals include pastors, counselors, psychologists, social workers, and security personnel. The Custos Rotalorum of Manchester, Garfield Green, convened the group of concerned administrators and organization leaders recently to provide support to the Manchester Police and citizens of the parish. A statement from the Office of the Custos says the group will work on addressing social ills within the parish, for which 36% of the total crimes reported are related to domestic violence and disputes. Interventions will include a directory of counseling professionals, which can be accessed by members of the public. The full scope and mandate of the newly convened group will be unveiled in the weeks ahead. Phase 1 of the construction of a tuition-free school being built in St. Catherine at a cost of $10 million is slated for completion by June. The institution's construction is being spearheaded by charity organization Crystal House Jamaica, with its parent body based in the United States. Minister with Oversight for Education Carl Samuda toured the project site on Friday and told JIS News that the government welcomed the undertaking.
I think that it is a gesture that is one of a kind, and it's one that Jamaica will serve Jamaica in an extraordinary way at this time when we are focusing on the development of our greatest asset, our human asset.
The first phase of construction entails building out the kindergarten block through to grade 6. Phase 2 involves the erection of a secondary school block with grades 7 to 13 classrooms, and that is slated to start in 5 years. Crystal House International's Senior Vice President, Treasurer, and Chief Financial Officer Joseph Snyder says the organization is proud to have been able to pilot the project in Jamaica.
Our first year of operations, we will actually admit grades K through 2. So 180 children will be served in our first year of operations here starting this summer.
The institution is being built on approximately 10.4 acres of land in Twickenham Park and will cater to 840 students from communities in Spanish Town deemed to be underserved. And finally, grade 4 students will sit their component of the primary exit profile on Thursday, June 25 and Friday, June 26, 2020 in language arts and mathematics performance tasks. The grade 4 performance task examinations seek to assess students' achievement of the national standards curriculum and their literacy and numeracy skills. The Education Ministry will be providing teachers with guidance as to how they can prepare their students for the new assessment. According to a bulletin from the ministry, all students will sit the examinations in centers presided over by external invigilators. The primary exit profile examination is a series of tests taken by students in grades 4 to grade 6. It replaces the GSAT as the National Secondary School Placement Test. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
The Ministry of Health and Wellness has made significant strides in ensuring that there's prosperity for all our citizens in a new Jamaica. Here are the 2019 achievements next.
In 2019, the Ministry of Health and Wellness, under this new name, made significant interventions towards improving the availability and access to quality healthcare services for the well-being of the population.
But we do more than that. We have allocated resources to support the upgrade to catch up with the gaps that existed in our healthcare infrastructure. And this is not a promise, it is a commitment.
Early in the year, the Infection Prevention and Control Unit at the University Hospital of the West Indies was outfitted with ICT infrastructure at a cost of $31.7 million.
This new system will help the university to be more effective in its combat against a number of infections and diseases, and certainly within a very timely manner, with the use of credible data at your fingertips to inform the decision-making and response processes.
The ministry also continued to integrate digital technology into the public health record system, and telemedicine services expanded in 3 health regions. Another major milestone was reached when the ban on certain types of sugary drinks in schools and public health institutions took effect in January. A $50 million health research fund was launched. In March, a $78 million mammography unit was officially opened at the University Hospital of the West Indies, boasting advanced 3D imaging machine for detecting breast cancer.
And therefore provides a much more accurate prescription. That's a three-dimensional approach.
A major achievement came as government began offering Jamaicans suffering from lupus access to medication at subsidized costs through the National Health Fund (NHF). The Health Ministry also tabled a 10-year strategic plan, a green paper on the proposal for national health insurance, and a major capital expenditure plan for the next 5 years. A memorandum of understanding between Jamaica and India set the stage for improved partnership to exchange and train medical professionals and set up healthcare facilities and initiatives for the prevention and control of NCDs. The Black River Health Center was reopened in May after a $13 million renovation and expansion project. A $29 million contract was signed and groundbroken for the construction of the Caenwood Health Center at Point Hill, St. Catherine. An eye clinic and training center was opened in Magotty, St. Elizabeth with the assistance of the Diocese of Poland and Food for the Poor. Under the ministry's Adopt a Clinic program, Massey Distribution Jamaica Limited committed $3 million towards upgrading the Seaview Gardens Health Center over 3 years. Similar agreements were reached for the Olympic Gardens and comprehensive health centers. Other developments included the renovation and expansion of the Black River Health Center, as well as the Stony Hill Health Center. Work progressed on the establishment of Centers of Excellence for Oncology and Nephrology at the St. Joseph's Hospital and the Cornwall Regional Hospital, as well as at the UHWI. Jamaica's first cardiology interventional suite was opened at the University Hospital of the West Indies in May.
It's a special occasion. It's an amazing achievement.
$3 billion was allocated for infrastructure development at 7 hospitals and 3 health centers. A capital expenditure plan of $27.2 to $31.2 billion was also unveiled for the next 5 years.
The largest investment in over 20 years in public health, and we are proud of it.
A further $6.2 billion in financing was secured under an IDB agreement to take care of critical infrastructure needs and the implementation of a health information system. And the construction of the Western Children and Adolescents Hospital got underway.
It is a 7th-floor hospital, 60 rooms for residence facilities, so staff, professionals who work in the institution will also have accommodation in the building. The building will boast outpatient emergency, surgical, lab, and intensive care services.
The existing Children's Hospital, meanwhile, benefited from a new state-of-the-art pediatric cardiac center in April. And later, a contract was signed and groundbroken for the construction of a new drugstore pharmacy also at Bustamante Hospital for Children. Phased restoration and upgrading work on the Cornwall Regional Hospital progressed, with work on the roof of the 10th floor under the first phase completed, and phase 2, which includes the demolition of interior walls and further strengthening of the hospital roof, advancing.
We're doing a major overhaul, and so when we would have been completed, we will have a hospital in Western Jamaica that will give top-notch service, both from the personnel who are here, but also in terms of the building and the equipment to give support.
Cornwall Regional Hospital's new $50 million radiology department was officially opened in June, with state-of-the-art X-rays, computerized tomography, CT scans, and ultrasound devices. Also in June, the Southern Regional Health Authority added 3 newly retrofitted ambulances, costing just under $31 million, increasing its fleet to 14. The Accident and Emergency Department at the Princess Margaret Hospital was reopened after extensive rehabilitation and expansion. New elevators were also installed at the Victoria Jubilee and Spanish Town hospitals. While launching a 24-hour mental health and suicide prevention helpline, the ministry bought 14 new buses to assist with community mental health service delivery and response. 200 transport or trauma stretchers and reclining chairs were procured for distribution to hospital A&E and areas where there are bed shortages. The Cornwall Regional Hospital was provided $20 million worth of surgical equipment and supplies. Meanwhile, a $9.4 million state-of-the-art ultrasound machine was installed at the Spanish Town Hospital. And Maypen Hospital's orthopedic surgical department was officially presented with a brand new C-arm X-ray machine to improve diagnostic services and patient treatment. The health sector also received a number of other donations last year. The $1 billion initiative to reduce waiting times in public hospital gained more traction last year. And in September, the ministry began contracting private labs to provide free diagnostic services for approximately 60,000 patients where the service was not available in the public sector. Meanwhile, a medical center was opened and a 10-year memorandum of understanding signed with the AIDS Healthcare Foundation to offer expanded services at the 3 regional health authorities.
HIV patients should be treated no differently from persons with diabetes or hypertension or any other such disease.
In March, the National Family Planning Board launched the Positive Health, Dignity and Prevention Framework and Annual Implementation Plan, which supports the ministry's Test, Treat and Stay initiative. A memorandum of understanding was also signed to make provision for persons living with HIV and AIDS and to activate the Fast Track Cities program in Kingston. In addition to $581 million in budgeted expenditure, $1 billion was approved for enhanced vector control interventions as the country dealt with a dengue fever outbreak. A second national insectary was also opened, strengthening the government's ability to reduce the spread of vector-borne diseases. As reflected in its new name, in 2019, the Ministry of Health and Wellness launched a 6-point wellness agenda for Jamaica, encouraging healthy eating habits, physical activity, and periodic health checks. The ministry also launched a physical activity guide in Braille in partnership with the Combined Disabilities Association. The compassionate care feature of the wellness agenda was expanded when the Noel Holmes Hospital began offering this as part of its services. Several pieces of legislation were also given priority attention in the past year, including the Framework Convention on Tobacco Control Implementation Bill, the Opticians Act, the Food and Drugs Amendment Act, and the Public Health Funeral Establishments and Mortuaries Regulations. These were some of the major activities of the Ministry of Health and Wellness in 2019 on a mission to realizing the vision for healthcare development.
plan will cover all workers aged 18 to 59 years in the tourism sector.
Catch the flights, see the cruises, as we look back on the jet-setting year of 2019 for the Ministry of Tourism.
Developmental planning must precede construction. Risk analysis must inform all our actions. Codes must be adhered to. Construction must be sound. And of course, where construction is done outside of the codes, statutes and regulations, then enforcement must come into play.
One of the main causes of cervical cancer is the human papilloma virus. Hear how you can protect your girls and boys from this deadly disease.
Globally, cervical cancer is the second most common type of cancer in women, with over 85% occurring in developing countries. Every year, 528,000 new cases are diagnosed, and there are approximately 270,000 deaths. By 2050, without any intervention, the number of diagnosed cases of cervical cancer is expected to increase to 1 million per year, with approximately 90% of the deaths occurring in developing countries like ours. A major factor is the human papilloma virus, HPV, of which there are approximately 200 types that infect epithelia, or skin tissue. At least 14 types of the human papilloma virus have been found to cause cancer of the cervix. Types 16 and 18 are responsible for 70% of cancers of the cervix, which is the second leading cause of cancer-related deaths in Jamaica. The virus can be transmitted through skin-to-skin contact, from mother to child at birth.
Current estimates indicate that every year, just under 400 women are diagnosed with this disease, with approximately 185 dying from the disease, with the majority of deaths occurring in women between the ages of 40 and 64 years of age.
A prevalence study conducted in Jamaica in 2010 revealed that the overall prevalence of any type of HPV infection was 54%. Cancer-causing HPV types were detected in 34.9% of the women, and HPV types 16 and 18 were found in 10.5% of the general population and in 71% of women with abnormal pap smears. This reality has prompted the Jamaican government to take the initiative to prevent cervical cancer through the introduction of the bivalent human papilloma virus HPV vaccine.
The World Health Organization, WHO, recommends that HPV vaccines be included in national immunization programs as a core strategy for primary prevention against cervical cancer. WHO states, Mr. Speaker, that HPV vaccination for girls ages 9 to 14 years is the most cost-effective public health measure against this disease.
More than 70 countries around the world, including more than 20 countries in Latin America and the Caribbean, have already introduced the vaccine. Several studies and monitoring by the World Health Organization, WHO Global Advisory Committee on Vaccine Safety, proved that HPV vaccination is safe and works extremely well, decreasing the number of HPV infections and related precancers. The bivalent HPV vaccine, introduced by the Ministry of Health in schools at grade 7 to girls ages 9 to 14, provides for 90 to 100% protection against HPV types 16 and 18. The vaccine is offered free of cost.
Bear in mind too, by the way, the cost to administer one of these vaccines, for us, the cost is somewhere in the region of $7-8 US. If you go into the private sector, you're looking at anywhere from $11,000 to $15,000. So it's not inexpensive.
This vaccine is not mandatory, and beneficiaries received opt-out forms for parents and guardians to give or refuse permission for their girl child to receive the vaccine.
We can take it that the indication, if anything, is that they want this. They identify with this. I remember one girl indicated that her mother actually called her aunt, who is a nurse, for advice. So that spells good. It says that persons are prepared to consult, get information, and then make informed decisions. And so that is going well.
Approximately 22,500 girls were targeted for the vaccine's introduction in 2017, with each girl needing 2 doses given 6 months apart for full protection.
Generally speaking, the process has gone smoothly.
The school-based strategy for implementation seeks to facilitate greater access to the targeted population. This covers the cost for social mobilization and communication, cold chain equipment, training and sensitization, and procurement of vaccine and vaccination supplies. And this disease prevention strategy will save the government millions. The Ministry of Health estimated that annual cost for the program after introduction will be $73.3 million Jamaican dollars.
In Jamaica, the estimated cost is of the just under 400 cases annually, Mr. Speaker, is some $274 million. I should point out that this figure is only for radiotherapy and does not include diagnosis and chemotherapy.
And for the individual, not just the emotional and physical trauma caused by this cancer is removed, but the financial burden.
In the United States, cost on diagnosis is approximately some 15,000, just under $16,000 US. If the patient survives for a year, this rate goes up to approximately $30,000 US.
Despite vaccination, persons will still need to do their routine pap smear to check for any threat or signs of the cancer, as the key to effective treatment, if it should occur, is early detection. For more information or to have your concerns answered, you can call the Ministry of Health's toll-free line 1-888-1-LOVE or 1-888-663-5683. Also email hpvinfo@moh.gov.jm. You can also visit the website moh.gov.jm as well as social media channels.
That's all the time we've been allotted on this station, but be sure to join us tomorrow for another information-packed program. We're available at your leisure online. There's our website, or YouTube channel, or pages on all the major social media platforms, and we also have a free mobile app that's Android and iOS compatible. On behalf of the entire team here at the JIS, I'm Theodore Henry. Thanks for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.